Emergencies can strike anytime, anywhere. Knowing how to respond correctly can make the difference between life and death. We're here today to debunk some common medical myths that have slipped into our collective consciousness. We've all heard the old wives' tale that if someone is having a seizure, you should put a spoon in their mouth to stop them from swallowing their tongue. However, this is not only incorrect, it's also potentially harmful. The appropriate response is to call for medical help. Make sure the person is safe from injury and monitor their breathing. Another myth that often circulates is the belief that cardiac compressions should be administered in all cases of unconsciousness. But did you know that if performed improperly, these compressions could lead to a broken rib or lung damage? The rule of thumb is to only apply compressions if the person isn't breathing or doesn't have a pulse, and always follow the correct rhythm. We're also going to tackle the myth about the overuse of paracetamol. Taking too much of this common painkiller can lead to liver and kidney damage. Always stick to the prescribed dosage and never mix it with other medications unless advised to do so by a healthcare professional. And what about nosebleeds? Contrary to popular belief, tipping your head back can actually cause the blood to flow down your throat, which isn't pleasant and can cause further complications. The best approach is to keep your head upright, apply a cold pack, and apply pressure. If the bleeding persists, seek medical attention. Remember, correct responses to emergencies are not only safer but can also save lives. Stay tuned for our next scene where we'll discuss the proper responses to more types of emergencies. Got a nosebleed? Don't tilt your head back. Contrary to popular belief, keeping your head upright is the way to go. Try to remain calm and apply a cold pack to your nose, applying pressure to stop the bleeding. If the bleeding continues for more than 20 minutes, it's time to seek medical attention. Now let's say you come across a road accident. It's natural to want to help, but remember, moving the victim could worsen their injuries, especially if there's a potential head, neck, or spinal injury. Instead, call for medical help immediately and try to keep the victim calm until help arrives. In a scenario of suspected poisoning, time is of the essence. Dial for an ambulance straight away and try to provide a clear description of the victim's symptoms. However, avoid inducing vomiting unless directed by a healthcare professional, as this could lead to further complications. When it comes to treating wounds, the right first aid response can be critical. One common misconception is the use of a tourniquet to stop bleeding. Incorrect usage could risk limb amputation. And while it might seem logical to clean a wound with hydrogen peroxide or iodine, these harsh chemicals can actually do more harm than good, damaging tissue and delaying healing. Instead, clean the wound with mild soap and warm water, and cover it with a sterile dressing. Remember, in every emergency, the key is to stay calm and act swiftly but thoughtfully. Whether it's a nosebleed, a road accident, suspected poisoning, or a wound, knowing the correct response can make all the difference. By adhering to these guidelines, you can ensure the best possible outcome in an emergency situation. Snake or insect bites may cause panic, but never attempt to suck out the venom. This old-school method can actually intensify the poisoning. Instead, stay calm, lie down with the bitten area lower than the heart level, and immediately call for medical help. It's crucial to remember that every second counts when dealing with venomous bites. Now let's switch gears to injections. If you or someone around you needs an injection, it's important to know how to do it correctly. Start by cleaning the area with mild soap and water or an alcohol pad. Then, target the right muscle region. The upper arm, thigh, or buttocks are common sites. Be sure to avoid tense muscles. They can make the injection more painful and less effective. When giving an injection, clean the area and target the right muscle region. From avoiding tense muscles to ensuring correct needle insertion, they all prevent complications.